For people living in rural areas, access to health care can be a challenge at times. Right now, more than 100 million Americans have limited or no access to primary care, living in what's being called a medical desert. Here to provide some insight into the issue and a solution for many people struggling to find that care is Dr. Adegoke Adeleke with Teladoc Health. Dr. Adeleke, thanks so much for joining us today.
Thank you for having me, Will.
So experts have called these areas medical deserts. We just mentioned that, but can you help us understand why rural healthcare access has reached such a crisis point?
Yes, as you know, a medical desert, there are geographic areas where people have limited or no access to essential healthcare services. And this could be due to several factors, including insufficient healthcare facilities or shortage of personnel, or long distance that they have to travel to get to seek care. And you had mentioned more than 100 million Americans have limited or no access to primary care. And since 2005, about 190 rural hospitals have shut down in the United States. So you can imagine that that really impacts the care that folks can get in those areas. And many people travel up to 90 minutes or even 2 hours one way to seek care at a primary care provider or a specialist office. So you can see that that can also lead to what we're calling healthcare deserts. And then all of these combined with a projected 87,000 shortage of primary care doctors in the next decade, that would also impact access to care. And these are some of the factors contributing to rural deserts. Now, if we actually focus on Texas, Texans, about 4.3 million Texans live in rural areas. Out of our 254 counties, about 202 of them are rural areas. And think about this, 1 in 5 rural counties don't have a primary care provider. And because of all this, there's higher incidence of chronic illnesses such as hypertension, diabetes, obesity, and also in Texas, about a third, about 33% of primary care doctors are 55 or older. So imagine that people are getting towards retirement age, and that also adds to the shortage of doctors available to take care of patients and leading to what we call these healthcare deserts.
Yeah, thank you so much for helping us better understand that picture at a national and statewide level. But we've heard that the federal government is investing $50 billion to try to strengthen rural health care. How does virtual care, though, fit into that effort?
Yes, this is it's a wonderful program that is the largest ever investing in rural health care. And the purpose is to strengthen rural healthcare systems by improving the access to healthcare, the quality, and more importantly, the sustainability of healthcare. Like I had mentioned, over 190 rural hospitals have shut down since 2005. Now, how can we bridge this gap? One of the fastest and easiest ways to do that is via virtual care. It's one of the fastest, most scalable ways to expand access to care while all these new facilities are being built from the investments, the $50 billion over the next 5 years. And a company like Teladoc, we're already partnered with states, employers, healthcare systems here in Texas that give rural residents access to licensed physicians and specialists that they need to help access care. And these investments will bring technology to the communities that need it the most. Healthcare is very easy. You can get on your phone, on your computer to seek care, and you don't have to drive 90 minutes or 2 hours one way to see a provider.
I mean, something that we've covered pretty extensively here at KXAN is that many Texas families in the rural parts of our state do not have reliable access to broadband, which could affect some of these virtual health options. So is there any kind of work being done to try to reach people still, despite some of those technological shortcomings?
Yes. We have a saying at Teladoc, we like to meet people where they are. So we want to meet you where you are, not expect you to have like big city internet connectivity. What we have invested in new platforms that allow secure visits using low bandwidth connection, so you don't have to have high speed internet. Then we also offer care through mobile apps. You can use your landline or just your regular cell phone, cellular networks. So you can connect from anywhere, from a farm, from a small town, a ranch, anywhere that has limited access. You don't have to be tied to high-speed internet.
Well, that is Dr. Adegoke Adeleke with Teladoc Health, and we appreciate you yet again taking some time to talk through these issues. Enjoy the rest of your afternoon and take care.
Thank you, Will. Thank you for having me.